Hi, my name is Will Fisher. Today I'm going to explain how single-payer healthcare works using PIE. We talk a lot about universal healthcare, what it is, and how it's important that every American has the healthcare they need when and where they need it. I think the most efficient way to do that is through a single-payer model. And you may be asking yourself, what is single-payer healthcare? So we're going to help you understand today using jelly beans. To be clear, what we are not talking about today is single provider healthcare, which is where the government actually employs the doctors and directly provides the care. Instead, we're talking about single payer system, which refers to the way we pay for healthcare and not the way it's provided. Here in the US, the quality of care is quite high. However, we need to improve the way we pay for care so that everyone has access to that same high quality care. Our current healthcare insurance system in this country is in shambles. Americans are being charged way too much money for the level of care they're actually receiving. The reason for this is an overly complicated payer model. Much of what we pay towards healthcare goes to pay costs that are not directly patient related, such as administrative overhead, which is inherent in any system. But our current system is full of duplication and inefficiency. Such costs also include the donations that the healthcare industry is giving to our congresspeople, like Michael Burgess, who receives hundreds of thousands each year from private health insurers. These costs ultimately increase the deductibles and premiums that we all pay. Back in 1996, for example, healthcare costs were only 3.5% of a family's total gross income. Now in 2017, the total is 18% of a family's income. 18%. How did we get here? 3.5% in 1996 to 18% in 2017. It's really hard to justify that kind of increase. Like the frog that's adjusting to the hot water, we've been slowly immersed in this increasing cost system, and now we're almost to the boiling point. So in our current system, we have a lot of different payers, and we have a lot of different ways that we pay for healthcare. In terms of payers, we have both private and public payers. Private payers are the private health insurers that anyone with employer-provided healthcare insurance has. Public payers are those administered by the federal government, like TRICARE, Medicare, Medicaid, and the VA, which is both a payer and a provider. Also in our system, there's a lot of different ways that each of us individually pays for healthcare. The red jelly beans signify the portion of premium an employee pays in an employer-provided plan. The yellow signifies the portion of the premium that the employer pays in the employer-provided plan. The black signifies the deductible that you have to pay before you receive benefits under your insurance policy. The green here signifies the copay. When you go to the doctor, most of us have to pay a copay just to see the doctor. The white signifies the coinsurance that you pay, which is the portion of healthcare costs that you pay after you satisfy your deductible and before you reach your out-of-pocket maximum for the year. The orange signifies the portion of healthcare costs that are paid by everyone through taxes, whether it's Medicaid, Medicare, or state taxes. All right, so this represents one American's annual cost of healthcare in our current system. But in a single payer model, we consolidate all of the payers in our system and we consolidate all of the different ways that each of us pays for care by paying for healthcare solely through taxes. Comparing these two jars, it's about the same number of jelly beans, with this jar representing our total annual cost of care in a single payer model. However, there are savings in a single payer system that we haven't accounted for yet, so let's talk about those. First, by consolidating the payers, we're saving quite a bit in overhead cost, CEO pay, process fees, system fees. A little bit comes out as well for profits of the private payers, as well as dividends that we pay to shareholders. Some more comes out for the pharmacy benefit managers and the brokers, those that are going out there marketing benefit plans to insurance companies and employers. The single payer also has a lot of leverage to negotiate drug prices. So here's a little more for the decrease in drug prices and costs that we'll all pay going forward. In a single payer system where everyone has coverage, you'll also see more people going to get preventative care rather than going directly to the emergency room. There are a lot of savings there. And here's some more for the percentage of Americans that can't afford to pay their medical bills, so hospitals and providers have to just write it off. You and I end up paying that with increased medical costs. In a single payer system, we'll limit that. As you can see, In a single payer model, there are a lot of savings to be had from a reduction in overhead and the overall reduction in healthcare costs. Our current system has many overlapping costs and unnecessary expenses. Simply put, there are a lot of complications. Who knew that healthcare could be so complicated? Thanks for taking time with us. My name is Will Fisher, and I'm running for Congress in 2018. I pledge that I will go to Congress and fight to make universal healthcare a reality for all Americans through a single payer model. My team and I are working hard to make this a reality, and I invite you to join us.